Now, I came back to the New York City area in 1976 for a number of personal reasons, and I wound up applying for the last residency slot in occupational medicine, open here at Mount Sinai in 1979. Again, by chance. I was working in a workers' comp practice in Paterson, New Jersey, seeing some 60 patients a day, dictating while I examined, for a physician who was, as in New York, workers' comp in New Jersey is an oppositional adversarial situation. You've got doctors and lawyers on one side for the workers and the other ones for the companies, and he was oriented towards protecting workers, but he had a real business going. Now, my employer had known Dr. Selikoff from Paterson for many, many years. And he said to me, why don't you go take specialty training in occupational medicine at Mount Sinai? Because he thought that he could charge more for my services if I was board certified. Right? I had no illusions about what was going on. Now, I didn't know that there was such a specialty as occupational medicine at the time. I had no idea that there were boards, etc. And I knew nothing about the program at Mount Sinai, and somehow or other I had long forgotten Selikoff's visit to Pottstown, Pennsylvania, that this was associated with Mount Sinai. But the idea appealed to me enormously, to get out of that practice and get back into academic medicine and learn some things, maybe even teach something, was enormously appealing. So I applied. And I want to just describe the day of that interview because I think it's instructional. The day of that interview started really bizarrely. I was sitting alone in Dr. Selikoff's office, the one that Phil came to use after, when we were in the basic science building. And I was sitting alone at the table. The room was empty, right? And as I was sitting there, I heard very loud voices in argument approaching the room. And in walked Dr. Lillis and one of her associates, screaming at each other about the right way to analyze the data she wanted analyzed. Now, some of you may remember Dr. Lillis. She was a wonderful, brilliant woman who was a great teacher and mentor and a tough woman, right? So when she was screaming at you, this was not an easy blast to escape. They stood in the room, totally ignoring me, and yelling at each other for a good 5 minutes, and then walked out of the room, continuing the screaming down the hall. I figured I was being part of a stress interview. It used to be at Harvard, they said if you went for a medical school interview, the interviewer would ask you to go open the window, and the window would be nailed shut or something, and they would see how you would handle this difficult situation. I was sure I was in the middle of one of these things. I was being videotaped, when I thought I was alone. So I really didn't know what I was getting into. Then Dr. Selikoff walked in the room. And so it was Dr. Selikoff and me, just sitting there. And the first question, virtually the first question, was, have you ever been involved in any activist organizations, around the issue of healthcare? I figured that was a really strange question, and probably a legal question, And I was really afraid to answer, but I figured, look, I better answer honestly, because God knows what he knows about me already. Right? And I said, well, yes, I have. Right? And he said, good. Right? He didn't ask me, did I know how to examine a chest? I guess he figured, I knew how to examine a chest, because I'd been out in practice. I mean, that's no guarantee of anything, but, I think he was not worried about my medical competence, but was worried about my orientation, how I thought socially and politically, and when he accepted me into the residency program, I figured that he was not afraid to bring a troublemaker of some sort, into the situation here, because I think that was his own view, that he understood that it was important to have a certain social orientation towards what happens to working people and their communities, and he was looking for someone who came with something of that understanding. He didn't like very much that I was as wild and crazy as I appeared, and probably was. I still had long hair and a big fat beard. And he used to say, look, all roads lead to Rome, but they're all on the surface of the earth. And he thought that I was about 15 yards above the earth in a lot of my thinking and behavior, but thought maybe I was salvageable. So I think having gotten that last slot, that last residency position was an extremely good example of being lucky. I've been here at Sinai ever since. I no longer am able to describe myself as a medical vagabond, which I used to accurately. And this has really been a lucky turn of events for me.